Nursing Code of Ethics, Provision 3 by Christina Hall. Provision 3 for the Nursing Code of Ethics focuses on how the nurse is to promote, advocate, and protect the health, safety, and rights of every patient in their care daily. In the emergency department, there is always a heightened sense of awareness for protecting patients' rights and giving safe, exceptional care while always advocating for the patient's immediate needs. The focus of this paper will be to patient safety in the ER being the first priority. Each patient is seen and treated based upon a triage level and is given emergency severity index score ranging from a 1 to a 5. When a patient is given a higher score, they are placed into the hospital's quick care area to free up space in the main ER for more severe patients to be cared for. Overcrowding in the emergency department decreases the amount of time that a nurse can focus on each patient, and the overcrowding often causes the nurses to become overwhelmed and potentially increase the chance for patient harm to occur. One afternoon, the triage nurse was in the main ER triaging a stroke patient when a call came back that there was a patient in the lobby with chest pain. No one responded to the first call for the patient with chest pain, so a second call was made, making the charge nurse think that there was now 2 chest pains waiting in the lobby needing care. The charge nurse called for help getting these patients to the main ER for treatment. The charge nurse opened the door and called out for the patient that was having chest pain and immediately took the patient back to a room. Another nurse called for the second patient that was having pain and chest pain and proceeded to take them back to another room. While asking questions to the first patient, the charge nurse quickly realized that the patient was not having chest pain and asked the patient why they stated they were having chest pain, and the patient said, "I just know that you called for someone and I wasn't listening to what you said." While the charge nurse was busy with this patient, she overheard the call "STEMI alert" in the emergency department. The second patient was a true chest pain and had been made to wait while the charge nurse brought back what she thought was a patient having chest pain, and it turned out that the patient had pinky toe pain. The patient with the pinky toe pain was moved back to the quick care area to make the critical bed available for another patient because there was a lobby full of patients. First, was the patient with the toe injury treated right? Was his or her rights taken into consideration, and did the nurse advocate for this patient? Did the patient suffering from the heart attack receive treatment in a timely manner to prevent them from harm? And what could the triage nurse have done before taking the wrong patient back and delaying care? And did the overcrowding lead to the oversight? First, the patient with the toe injury was treated right. Was his or her rights taken into consideration, and did the nurse advocate for this patient? The patient with the toe injury was trying to avoid the wait in the emergency department by stating that she was having chest pain, which caused a critical patient to have to wait longer than needed. The triage nurse and the charge nurse should have restated to the patient once she was in the triage room what the patient had been there to be seen for prior to taking the patient to the main ER. A study conducted in 2013 reported that the triage area in most emergency rooms may be weakened, which affects the flow of the patient through the emergency department. This disruption can decrease the workflow, can increase the workload on the nurses and potentially the risk for patient safety. Did the patient suffering from the heart attack receive care in a timely manner to prevent patient harm? The patient that was suffering from the true medical emergency treatment was delayed just a few minutes, and the patient did not suffer any long-term effects from the delay. The registered nurse working was quick to recognize the ST elevation on the EKG and got the ER physician to the room to provide care for the patient. All treatment was provided, medication was given, and patient was prepped for the cath lab within 10 minutes. What could the triage nurse done before asking the wrong or taking the wrong patient back to delay care? If the nurse in the triage would have taken a couple extra seconds to ask the patient why they were seeking care, then each patient could have been treated appropriately without delay of care. It's the triage nurse's responsibility to ensure that each patient is receiving the right care. If the patient is over or under triage, then appropriate care may be missed or cause the patient to receive the wrong care. The triage nurse needs to use her assessment skills to appropriately place patients in appropriate rooms for each patient. It is the responsibility of the triage nurse to advocate for the patients to ensure their care is appropriate. Did the overcrowding in the emergency room lead to this oversight? The overcrowding in the emergency room was not the only cause of this oversight. It was the nurse's responsibility to ensure that she is bringing back the correct patient in the correct order. And the overcrowding, however, does put a strain on the ER nurses, physicians, and patients as a whole. In conclusion, the third provision is a guide for the nurse to follow to prevent patient harm. The nurse must be willing to put aside her personal beliefs when they are different from the patient's or the provision. If there is ever a time that the nurse cannot put aside personal beliefs to care for a patient, he or she should ask another nurse to switch patients with them so that the patient's wishes are always followed. When a patient presents to the emergency room for care, the triage nurse needs to be quick to provide an assessment and expedite needed care. The patient has the responsibility to be honest when presenting to the emergency department so appropriate care is given in a timely manner. And the nurse must remain an advocate for the patient at all times. The nurse needs to ensure that the patient's rights are put first. Patient safety and health needs to remain a priority for the nurse. The nurse needs to know his or her limitations and not be afraid to ask for help when needed. This shows great character and understanding of personal limitations. When a nurse acts outside of the code of practice, there is increased chance for patient harm or even death.